By the age of 50, approximately 50% of adults suffer from hemorrhoids. In this video, we will cover information on the causes of hemorrhoids, common symptoms, and the available treatments. Hemorrhoids, also known as piles, are swollen blood vessels in or around the rectum and anus. Think of them as varicose veins, but around your bottom. It's possible to have hemorrhoids without symptoms, but many do, some of which can be scary. Commonly reported symptoms include bright red blood after passing stool, the presence of a lump that can be felt after passing stool. This lump may require pushing it back inside, or it may remain outside permanently. Mucus discharge from the anus after passing a stool, soreness or redness around the anus, and those pesky hemorrhoids can also make it more challenging to keep your bottom clean. This may explain if you're experiencing staining in your underwear. You may also find that the area seems more itchy than it used to be. Fortunately, for most people, hemorrhoids aren't painful. However, there are some circumstances where the blood in your hemorrhoid clots, called a thrombosis. If this happens, it can be excruciatingly painful, and you should seek an assessment from your doctor. How severe are my hemorrhoids? Hemorrhoids are classified into 4 grades. Grade 1 is where hemorrhoids are small and cannot be seen or felt from outside the anus. Grade 2 hemorrhoids are larger and may prolapse but return quickly back inside. Grade 3 hemorrhoids hang down from the anus but can be pushed back inside with the help of a finger. And finally, Grade 4, where hemorrhoids permanently hang down and cannot be pushed back inside. What causes hemorrhoids? It's not always clear why a person develops hemorrhoids. However, we know there are several factors that can increase your risk, including being constipated, straining during bowel movements, heavy lifting, and pregnancy. Can I treat them at home? For the vast majority, the symptoms of hemorrhoids will clear up by themselves in a matter of days. Fortunately, you can do a few things to help ease your symptoms during this time. The first is dietary changes. Because hemorrhoids are commonly caused by excessive straining and constipation, increasing your dietary fibre and ensuring that you're drinking plenty of fluid can help ease the passage of stools. You can increase your fibre intake by consuming more whole grain bread, cereal, fruits and vegetables. Next is adapting your toileting habits. First of all, you need to avoid straining. Straining increases the pressure in your tummy, causing hemorrhoids to swell. Using a step when you go to the toilet can help raise your legs and make passing bowel motions easier. Using the step creates a more natural squatting position, which can straighten the rectum out. This improves the angle and allows for smooth evacuation of feces with minimal straining. Additionally, moisten your toilet tissue before wiping and gently pat dry to avoid discomfort when cleaning. This method should be the gentlest on your hemorrhoids, keeping you clean and preventing irritation caused by rubbing. What about over-the-counter medications? Hemorrhoid medications are available to purchase over-the-counter at your local pharmacy. These are available in different forms, including creams and pessaries. Most of these work to reduce swelling, irritation and discomfort. Importantly, these medications shouldn't be used for longer than 1 week without the advice of a medical professional. When should you speak to your doctor? The symptoms of hemorrhoids can often clear up on their own or with simple treatments available over the counter. However, it's essential to consult with your doctor if your symptoms persist or if you're experiencing pain, nausea, vomiting, a fever, or severe bleeding. Your doctor will be keen to rule out any other significant underlying health condition such as bowel cancer or inflammatory bowel disease. Fortunately, your doctor can diagnose hemorrhoids through a quick internal examination. They may prescribe some laxatives to help open your bowels and treat any underlying constipation. Steroid creams may also be prescribed if there's evidence of inflammation around your back passage. In more severe or persisting cases, you may need a referral to a specialist for further treatment. So what treatments are available via the specialist? Specialist treatments are carried out in the hospital or treatment centres. They can be broadly split into 2 groups: non-surgical treatments and surgical treatments. Non-surgical treatments include rubber band ligation. This is where a small rubber band is placed at the base of the hemorrhoid to cut off its blood supply. The hemorrhoid should then fall off on its own accord. Next is injection sclerotherapy. A chemical can be injected into the blood vessel supplying your hemorrhoid. The hemorrhoid should then shrink in size after a few weeks. And electrotherapy. Usually considered for smaller hemorrhoids, In this procedure, an electric current is used at the base of the hemorrhoid to affect the blood supply by causing a clot. After that, the hemorrhoid should shrink in size. And finally, surgical treatments. There are many different surgical techniques, but generally they're aimed to either remove the hemorrhoid itself, such as a hemorrhoidectomy, or further restrict its blood supply, causing it to shrink, such as hemorrhoidal artery ligation, where the feeding blood vessel is tied with a stitch. I hope you found this video helpful. Good luck with managing your hemorrhoids, and remember, avoid straining and increase your dietary fibre to keep hemorrhoids at bay.